Delivering a bad news is most sucky part of a nurse practitioner's job, but that can be unavoidable, and we want to make sure to deliver the news in most effective and comfort way for patients. So in this episode, I'm going to talk about 7 tips on how to deliver a bad news to patients. Let's dive in. I hope you are enjoying this episode. Before we go back, I want to quickly mention that I'm giving a gift to you for listening to this episode. I'm giving a free PDF nurse practitioner job interview prep checklist. This checklist is full of questions that you're likely to be asked during job interviews as a nurse practitioner and some tips on how to prepare for them. With this downloadable PDF, you can prepare for interviews well so you feel confident and stand out from other candidates to get the job that you really want. To get this free PDF nurse practitioner job interview prep checklist, you can go to usa.jnpproject.com/interview. Again, usa.jnpproject.com/interview. Now, let's get back to the episode. Delivering bad news to patients comes with our job as a nurse practitioner. I wish I can just deliver good news all the time, but that's part of our job. My current main job, which I provide women's health care, my patients are usually younger, teenager, women in 20s, 30s, 40s. I don't deliver such as a cancer diagnosis often, although I have to sometimes tell patients that they are going through a miscarriage. But my previous job, where I worked at a private practice, my patients are older. They were in 40s, 50s, 60s, 70s, and I had to deliver cancer diagnosis news every month. For my current part-time job, I work at a Japanese clinic, and majority of patients speak Japanese, and they are also in 40s, 50s, 60s, so over there as well, I have to deliver cancer diagnosis quite often. So I've been practicing as a nurse practitioner for 10 years, and along the way, I learned different tricks and methods from my mentors, my colleagues, and I also attend different conferences and lectures and picked up some skills and knowledge. And I feel like I'm improving my skill every year. This is my style, may not necessarily work for you, but I want to share what I do, and maybe some of the trick might work for you as well. So first thing is that when I have to tell a serious bad news such as cancer diagnosis, I always make sure to make appointment in person. I don't want to deliver a news over the phone because I can't see how patients are reacting to my words, and I also feel like being there in the same space means a lot. If for some reason patient cannot come in, then televideo might be a better method, but I definitely prefer to set up an in-person visit so that I can sit and have a talk with patient face to face and looking at her eye and deliver unfortunate news. Second thing is, I think I learned this from my previous boss, but try to schedule an appointment, in-person appointment in the end of the morning or in the end of the day, because you might have a very busy work schedule, you have a lot of patients seeing, and you might feel like rush and stuff like that. But when I deliver bad news, I want to make sure that they don't feel like I'm rushing and have to go somewhere. I try to schedule that appointment in the end of the morning or in the end of the day so I can sit down and answer questions, whatever questions they have, until they satisfy, until they don't have anything else to ask at that point. And also having a little bit quieter environment in the clinic might be helpful for patients to have a more private moment. Third thing is I usually rehearse what I'm gonna say, because telling bad news is still uncomfortable after 10 years, and I don't want to be too awkward, too uncomfortable, because that's gonna make patient uncomfortable as well. So I try to be calm and then rehearse so that it's going to be more smooth and I don't give any anxiety or a weird impression to patients. Nobody wants to give bad news. And if you feel uncomfortable, you're not the only one. I'm still uncomfortable. So that's why I like to do rehearsing so that I feel a little bit more comfortable and I can pay attention to patients' emotions and reaction rather than me worrying about if I'm saying things correctly. Fourth thing is I'm very careful about not to say I'm sorry. And this is hard because I'm from Japan and I'm sorry is a usual phrase for Japanese people. But in this particular case, I'm very careful not to say I'm sorry because I feel like the patients don't really need my sorry. Some patients may get mad when we say sorry because they don't need our sorry because that's not going to help them at all. When I tell patient about cancer diagnosis, I will make sure patient sitting down and I'll sit down and I say, unfortunately, your pathology result came back as cancer. Instead of saying, I'm sorry, but your result came back as cancer. Because I feel like saying I'm sorry itself is very negative and also it's not very helpful for patients. And when I read a lot about how the patients feel, they usually don't really appreciate healthcare professionals feeling of sorry to them. Fifth thing is I try to focus and emphasize and praise the patient's decision to come in. A lot of times it takes a lot of courage to come into medical office and face the diagnosis. A lot of patients postpone coming in because even though they are scared of cancer and more so they are scared so they don't want to come in, which from our perspective, of course they should come in as soon as possible. But from their perspective, it's a scary thing to do. So I focus on appreciating their action of coming into the office, and that's why we are able to diagnose as soon as possible. This way, we are focusing on the positive side of their action instead of promoting them thinking back, oh, I should have come earlier, because thinking back and wishing that something else was done before wouldn't be helpful anyway. Sixth thing is focus on the next step. So for my case, the patient had breast cancer, I'll say, unfortunately, your biopsy came back cancer. And I give the patient to digest the news. When the right timing comes, then I'll say, so the next step will be referring you to a breast surgeon who can stage your cancer, and they will get more information of what kind of treatment you need. And likely they're gonna be referred to oncologists. So I usually try to focus on what will be the next step so the patient can have some image of what would happen and prepare themselves. And seventh thing is to reassure that I will be there if they need any help. I literally say this to my patients, but I might not be able to answer all the questions because I'm not an oncologist and I'm not a breast surgeon. But I tell my patients, literally, I might not be able to answer all the questions, but if you have any questions or if you have problem with making appointments with them or not, feel free to call me anytime. I will do my very best to help you. And even if I can't answer your question right away, I could connect you with a specialist to get the answer. So I'll be there for you. So I emphasize that, hey, I'm gonna be here and I'm still gonna be your healthcare team. And whatever you need, I'll try to help you as much as I can. I hope this episode was helpful for you. If you like this episode, please give me a thumbs up and make sure to subscribe to my channel. I upload new video every Friday. Also, if you can share your experience of providing a bad news and maybe share your tips on the comment section if you're watching YouTube, that would be really appreciated. All right, I'll see you in the next episode. Aloha.